Good day, I am Pat Aridante from BS and the 12K, and for today, I'll be going to perform perineal flushing return demonstration. The purpose of this procedure are to remove normal perineal secretions and odors, and to promote client comfort and to prevent infection or contamination from the rectum. So prior to the conduct of the procedure, we must ensure the equipments we need is present. This to save time and effort. So the equipments we need are a solution bottle or sterile water, a container filled with warm water, clean gloves, basins, 7 pieces dry cotton balls, 7 pieces cotton balls soaked in a cleansing solution, bedpan to receive and rinse water, newspaper to line and cover the bedpan, draw sheet and rubber sheet, forceps, and if necessary, a perineal pad. Next is we're going to wash our hands or perform hand hygiene as universal precaution. Okay, so now we're going to explain the procedure to the patient, if not comatose or mentally retarded. This is done to let the patient understand the procedure and to gain the patient's cooperation. Good day, ma'am. I am Pat Aridante, your student nurse for today. So please state your complete name, ma'am. Your birthday, please. Okay, so for today, ma'am, I'll be going to clean your private area from your genitals to your perineum. This is done meant to promote hygienic care and prevent infections or skin irritation in your private areas. If you may feel uneasiness or uncomfortable, ma'am, feel free to say it, okay po? And don't worry, ma'am, as I am going to lock the doors and cover areas of your body that are not included in the procedure. So may I now proceed, ma'am? Okay, thank you. So next is, it is really important to provide the client's privacy by locking the patient's room and drawing on the curtains. Okay, so now we're going to wear gloves for infection control. Okay, so we will now position our patient in a dorsal recumbent or back lying position with the knees flexed and spread well apart. This is done to provide good visualization of the area to be cleansed. Okay, ma'am, can you flex your knee and spread it, please? I'm going to assist you. Okay. So now, since my patient is already draped with a blanket, we're going to expose now only the part to be cleansed, because minimum exposure lessens the embarrassment and helps to provide warmth. Okay, ma'am. So I'm going to expose your perineal area. Would that be okay? Okay. So you'll now then place a rubber sheet or draw sheet and bedpan under the patient's buttocks. We do this to prevent the bed from becoming soiled. Okay. After that, we're going to inspect the perineum. Okay, we're going to note the particular areas of inflammation, swelling, excessive discharge or secretions from the orifice, and the presence of odor. And we're going to flush the perineal area with warm water. Use warm water to prevent chilling and soften or dissolve blood clots. Okay, ma'am, now I'm going to pour warm water. Okay, ma'am, is it okay? Is it warm? Okay, thank you. Next is we're going to get the 7 pieces of cotton balls soaked in a cleansing solution using pick-up forceps to maintain sterility. Okay, so now we're going to cleanse the external genitalia starting from the midline of symphysis pubis down to the anus. Never trace a stroke. Never trace a stroke to prevent contamination of the area. Next is we are going to, with the second cotton ball, cleanse starting from the mons pubis in figure of 7 by way of external labium towards the anus. Okay. Secretions that tend to collect around the labia minora facilitate bacterial growth. Next is we're going to do likewise on the opposite side of the next cotton ball. And we're going to discard it. Okay, and the fourth cotton ball, we're going to cleanse starting from the mons pubis in figure of 7 by way of internal labium towards the anus. And we're going to discard it. Now with another cotton ball, we're going to do likewise on the opposite side. And we're going to discard it. Now with another cotton ball, we are going to cleanse the groin, starting from groin going up to the thigh. Okay, we're going to discard it. And we're going to use another cotton ball to cleanse the other groin, going up to the thigh. We're going to discard it. Okay, so after that, we're going to flush the perineum thoroughly with the sterile warm water. Okay, ma'am, I'm going to flush again a warm water. Okay, and using dry cotton balls, we're going to dry the perineum with the same stroke that we did earlier. Thus, moisture supports the growth of many microorganisms. And starting from the midline of the symphysis pubis down to the anus, I'm going to discard. Starting from the mons pubis in figure of 7 by way of external labium towards the anus, I'm going to discard. And on the opposite side, now we're going to cleanse starting from the mons pubis in figure of 7 by way of internal labium towards the anus. We're going to discard. And on the opposite side, and we are going to discard. And also use another cotton ball for the groin, starting from the groin going up to the thigh. I'm going to discard. And do likewise to the other side. Okay. So now we are going to remove the bedpan gently and turn the patient to the side. Okay, ma'am. I'm going to remove the bedpan, and can you please turn to your side? Okay, thank you. I'm going to assist you. Okay. And if necessary, take one cotton ball and clean the side of the buttocks to provide comfort. Now we're going to turn the patient on her back and make her feel comfortable. Okay, ma'am, you can turn to your back now. I'm going to assist you. Okay, so now we're going to spray with antiseptic as needed to promote healing. And afterwards, ma'am, I'm going to spray now the antiseptic spray to promote the healing of your perineum. And with that, put the perineal pad with an up-down motion as needed to prevent contamination of vagina and urethra from anal area. Now I'm going to put a perineal pad now to avoid contamination. Okay. So now, ma'am, that we're done, how do you feel? Are you okay? Are you comfortable, ma'am? Okay, thank you so much, ma'am. And you can go back to your position now, comfortable position. I'm going to assist you. Okay, so do aftercare of the materials used, then remove and discard gloves and perform hand hygiene. And after that, record the treatment done to the patient and any unusual findings such as redness, excoriation, skin breakdown, discharge or drainage, and any localized areas of tenderness. From documentation purposes, that procedure was done and means of communication. So that's it for perineal flushing return demonstration. Thank you and God bless.